Alright, so once you have your software pulled up to take your x-ray, you want to make sure that all of your selections are correct. So whether you're taking a panel, a CEF, or a CBCT, you just want to make sure that one is correctly selected. Make sure that the HD is selected. The normal and the UHD are usually about like how much time is spent taking the image. So we usually stay on HD. You want to make sure it stays with normal, and this one is always on standard. Down here, when you get down here, is like when you select which one is best for your patient. Typically, patients that are 12 years or younger, you select child, and then anything else would be a woman or a man. And then you want to keep this one on normal. And then once all of those are in the right positions, you just want to press confirm, which will initialize the panel machine, and then you're able to get your patient into position. Okay, so on this pad you have buttons that help control the different beams on the panel machine. So these two buttons move the panel up and down. These two buttons move the tragus beam up and down. And then these two buttons close the head holders, and they open them as well. And then once you have your patient in position, you can press this ready button, or you can press it on the computer. Okay, so now we're going to initialize.
The system is initializing. Please wait.
Okay. And then you want to place your barrier around the piece that the patient will be biting on. And then you have the patient come right over. I'll have you hold on to these handlebars for me. You're going to move the machine up to the patient. Now I'll have you step forward. You can go ahead and lay down this tab for me. And then I want you to slide your teeth back towards you. Perfect. Now I'm going to have you step your feet forward. And you want to make sure that the patient is kind of leaning in a little bit. And make sure your feet are shoulder width apart. Okay. Alright, so once your patient is in position, you want to make sure that these red beams line up. The one that goes across is typically with about the tip of the nose, and then smile big for me. The one that goes up and down, you want to make sure it's in the center of the canine. Okay, and then close your lips and swallow. Then you're going to close the head holders, which they'll just hold the patient's head in place. And then you can press this ready button right here, or press it on the computer.
The system is moving into capturing position. Please wait. The system is ready to capture an image. Please close your eyes until image capturing is complete. Image capturing is complete. Please open your eyes and follow the operator's instructions.
So we're just gonna wait for it to stop moving, and then you can step out. Okay, you're good to step out. Okay, so now once you've taken the x-ray from the patient, this screen pops up. And usually it starts with the middle button, but you can either scroll down using the mouse or you can click on each button and it just gives you a different quality of the picture. Typically, this middle one and the one underneath it will be your best quality, but if you want to go through them and decide which one is the best to you, you definitely can. And then once you pick whichever one is best, you would just press the save button and it should upload into the patient's file.